Ivoria, Donatella.
Misafirlerin ikisi dışarıda.
Are we ready?
Yeah.
Are we ready for the one of the most special session of today? We have a guest speaker that came all the way through from UK to here, just actually to give us this experience what is happening in the health industry. And today we will also touch how the beauty is shaped by the industry and how we see the reflection on our health, the woman health. And I would like to invite Pakize Durmaz, who is a warrior, who is a nurse in NHS, onto the stage. So grateful to have you. Pakize, welcome. And first of all the way you have come through just because of this really amazing passion that's driving you to come all the way. We just had, I think, maybe 5 minutes call, and then she said, I'm coming in. Because I think the data in the national health, it's really warning right now, especially for women who has a lot of insecurities and also reflection on their mental health. So we will hear from you first of all. I would like to ask you, what actually makes you woman in this industry? How do you feel about it?
Thank you very much for inviting me. First of all, my name is Pakize and I'm Turkish, like Neslihan. And I was born in a little village in Turkey, and I always want to become a nurse because I wanted to save the life and save the world. So I'm really proud to be nurse. But just Neslihan said, being a nurse is a difficult job in the health sector, especially in Asian culture. So as you guessed, doctors are mainly male, and you are the nurse and you expect to do what you asked to do. But what we expect now from nurses to be professional and stand up and voice up. Because we know that when nurses speak up, they save the patient, they protect the patient, not only themselves, also really protect the patient. That's why I really support women to be powerful so they can speak up. Obviously, when Bivoris, when you invite me, when you talk about your project, I was so excited. I said, oh my God, we want to do this one for nurses, we want to do this one all health worker, to be able to be powerful, to be able to be speak up for themselves and also for the patient. So thank you for that.
My pleasure, definitely. And I think if we can call as warriors, I think all the nurses, if we can just recall a few years ago, what the role that they played during the pandemic, the COVID time, while we were stuck at our home, but they didn't have that chance, and they were fighting just to get all of this crazy period in our life. I think we did not appreciate their work enough. I feel like the world even started to forget about this. But I think if we are survived today, after the COVID,
I mean, I have to admit, even myself, after COVID, I had a depression because I just felt I'm not good enough. I couldn't save enough people. So
you have seen people die, right, during this period?
Perhaps, first of all, we lost our own colleagues.
Oh.
So a lot of, obviously, our colleagues died as well as patients. So to cope with that feeling, like I work myself as a management role. So when I find out one of my nursing staff died because of COVID, so you feel responsible. You feel, oh, if I done enough for them, if I support them a lot or not. So then I become myself that I need a support, I need healing. So that's why I know this process is so important. But since COVID, we're still very tired. We're still working very hard. people not realizing because of that a lot of now the people in the NHS become off sick because of the mental health problem or depression because we haven't recovered yet from the COVID-19 effect. So that's why the opportunity like that, retreats and coming the women together and sharing the experience and bringing the positive energy, I think is very helpful. So thank you for that.
Oh, what a pleasure to hear this from a nurse, seriously. And I was just so shocked when I read a lot about the mental health facts for women, and especially how they see themselves on the mirror and how the perception. Don't take me wrong, I even have my own insecurities. I have some things about my body that I am not completely feeling comfortable. However, I think somehow just recognizing that, okay, Leslie, this is not maybe perfect for you, but okay, accept it. It's just helped me to give more acceptance to myself, and I think it is the period of journey of becoming woman. And I'm so grateful that I am aware of this, and thanks to my teachers, thanks to the women in my life that were inspiring for this. But I read that 1 person out of 8 women today on earth has the decision to suicide. 1 person is out of 8 people. This is crazy. Like they have a thought to suicide just because of their how they look, because they don't feel themselves beautiful. But why? Because they don't feel like they are beautiful by nature, because of the social media expression.
I was just gonna say, because I think social media affect people, and sometimes our patients expect perfect care, which they rightly expect this, but they have to remember that the people they're looking after them, they're women. Sometimes they have a problem with their self-esteem. There's a lot of research shows that nurses have problems sometimes with self-esteem or body, how they look like. We have infection prevention policy at the moment. Nurses cannot have eyelashes, for example. But a few nurses cry on me to say that when they take off their eyelashes, they feel very, very low. So something their body image affected when they take it off. So
It's just eyelashes, but you see the impact on nurse.
yes, and then if that person not happy, then we cannot expect she will be happy to patient as well. That's why I think the solution for me here that we really need to be kind each other and support each other, and to listen that person needs and try to meet their needs. That's why, I think by warrior, it will help our warrior nurses.
Oh, hopefully we are getting there. And I think for me to be a nurse, and my cousin is nurse, and she did an amazing job for us for the collection. She helped me a lot, Zeynep, and I was so close to her when she was choosing to be a nurse. And I think being a nurse is the most feminine job on earth, because as we are women, we meant to heal, we meant to nourish. I think this is the core of being a nurse. Like
Yes.
we are just nourishing that person.
I mean, hello to Zeynep. We say as a nurses has to be creative, because especially in Turkey, we work less equipment, for example, then we have to make it.
Yes.
So then, as a woman, you have to use your creativeness, so you create things for the patient, really. So other things, because of the Zeynep, I just want to obviously share with you. Obviously, where I come from, I've been in England now for 20 years. I am now a management role in nursing in England. Now, what I want to do, I want to give now. So that's because of that I try to be inspirational leader and role model for my nursing colleagues, especially in Turkey. So I guide them, I encourage them to be powerful, and I show them if I become an international nurse, you can be international nurse as well if you like. So I think sharing this positivity and experience internationally, I think help everybody.
That is amazing. She's moving the nation with her. This is the Bulgarian woman. And I think like in every country, we need nurses to really embody that they are really serving to humanity. And they proved this during the COVID time. I think they just need to have to see the more appreciation and the value. This is my observation, because what you are doing is really it has an enormous impact. We just need to see and appreciate this. Thank you so much what you are doing for
Thank
us.
you so much for giving me this opportunity to talk about nursing. Thank you.
It is our pleasure. And I would like to add one more thing. As in the ambassador community, we have Maya, who is actually from Bulgaria. What a coincidence. But unfortunately, she couldn't make today happen. But she prepared us a nice video. She is our face for the body positivity. She has a very unique shape, and I love it. And I love her self-confidence. I love her femininity, and you will feel it when you will see her video. And I think it is time to share now. Let's hear Maya. Just a minute. Okay, perfect. How are you doing, by the way? I know we are getting hungry. And I have a very special guest here. Thank you really so much for being with us today. It is such a pleasure. I can't believe still this is happening. I don't know what's going to happen even after all of these recordings that we are going to spread to the world. We are going to inspire, we are going to move the people with us. And we need gentlemen who are supporting us, and thank you so much for that. And maybe one more research that I read, and it's also, I think, very impressive. One person out of 13 people, 13 women, let's say, one person out of 13 women is depressed because of the body shape. Isn't it just alerting? Isn't it just giving us the message that something is really, really wrong about our beauty perception? Yeah. Now this one, Maya. Yes, we are testing this today because tonight we will rock it with our models on the stage. Yeah. Sometimes it happens. Maya's from Bulgaria, but she's living in UK. And she's working for a tech company, by the way. So you can be in corporate life, but you can still pursue your passion. And this is also a part of my journey right now. I'm still working for the corporate life. Yes. Maya Kakaro.
Did you know that some 10% of women have committed suicide due to body image, compared to only 4% of men? But at the same time, 13% of adults have committed suicide in total and have had distressing thoughts due to body image. When people criticize this kind of trend of body positivity, and they criticize curvier women being on front covers, more plus-size models, they don't realize that they're so based in superficial and shallow thoughts that they're not actually thinking of the bigger picture, and the bigger picture is our health and our mental health. Body
I think we've finished.
Yes.
But I think you heard the most special and important part. So I think it is important that because of the social media, maybe even because of the modeling industry, that we need to see the woman in a certain shape. It's a lie for women to feel beautiful. It's a lie for women to feel beautiful. I can't repeat this enough, and I have gone through also. And I think one day I will have also security enough to also show you my pictures 10 years ago. And you will also see my transformation. But as a person who was fat and then now had this really transformation in my life, I just want to say every woman, lose weight for your health, but not for your beauty. Do something for yourself, but not to feed yourself for the society. Do something for yourself to feel this embodiment with your body, and that's why Bivori is just a reminder for those essence. It's just the charm our products. It's not real. You are making the real job. When you put on yourself, when you look yourself in the mirror, you will feel how actually beautiful by nature. And hopefully, this session first will be the reminder for nurse what great job they are doing it for us. And thank you so much for their all nourishing femininity. And thank you so much, Pakize, so much. Oops. The microphones are so excited today. Yeah, thank you. So now we have the last two sessions, and I would like to have Krasimira, who is a passionate leader for sustainability, and this is one of my other passion, really to make a change for Earth, to really be a changer with the amazing women leaders. And let's see what Earth needs from us and what kind of things we need to do together. Okay? Wait for the last session.